Are you considering a beard transplant to fill in your gappy areas or your thin areas in your beard? Stay tuned, we're going to talk about that. Welcome back to the channel. Hope you're doing great today. So we've had some requests for case studies. And I thought it was a great idea. These are ways that we can communicate specific details on a specific procedure for you guys so you can learn more about it. So I decided to put together this case study here to start this new sort of series of videos. And we're going to talk about beard transplants. I just so happen to have done probably 2 or 3 beard transplants in the last couple of weeks or so. They're becoming much more common. Everybody wants to have a full, even beard. Most of us have little spaces, little gaps where we would like to fill in. Not all of us can grow a full, even beard. So transplants work great for that. And I'm going to show you a friend of mine who actually works with us as well. And I'll take you from his pre-op photos and pre-op plan all the way to the results. So here it is. His name is Jean, 44-year-old male. Again, he's a professional photographer, but he works with us here at the practice. He's from Brazil, originally like us. And he does the graphic design for us, for our practice. So a very good friend, very good guy. Wanted to grow a little bit of hair right here under his lips, under the lower lip here, and connect the mustache to the goatee area. So the proposed surgery was an FUT. You can do FUE also for beards, it's fine. But because he was a smaller surgery and he likes to wear his hair long, as you can see here, we decided to do an FUT on him. Simple procedure with great results too. We proposed anywhere between 800 and 900 follicular units for his surgery. The final graft count was 884 total. So we proceeded with the transplant. Again, the goal, just a magnified picture here, fill in these areas under the lip. You notice that he has a little redness right here. He had this little chronic irritation. A lot of us do have that in the beard area. We treated to calm it down before the procedure, but this was not an issue. So go again, fill in these little gaps here, fill in under these where he has a little disconnection, and also right here on between the mustache and the goatee. This is the preoperative marking. We have another video that I recorded where I kind of mentioned how I like to mark things really well. So that's what I did for him too. You can see there's a little bit of a purple marker here. And that's where we're going to connect the mustache to the goatee. We're going to fill in under the lip. Some of us like to have the full curtain of hair under the lip. Some of us like to have more of a center fullness here and then leave little gaps. His preference was to go all the way around. You can always shave it down and trim it if you want to, of course. These hairs, once we transplant, they'll grow no matter, like just like the normal hairs will grow. And you can also shave it just like normal. So he decided to go for more of a full coverage there. I thought this picture was pretty cool. This was right after we were done with the procedure. It took about probably 4 or 5 hours to do. It's all done under local anesthesia. I do nerve blocks on the face so that there's very little discomfort with the anesthesia, with the local anesthesia. We gave him a little bit of Valium, similar to Valium drugs, so he could relax. Nothing IV, all by mouth. And he was, at this point here, he was looking in the mirror to see where the hairs had been placed. So this is right after we were done. You can kind of see here, there's some, red little spots there, but you can see the redness overall where we placed the graft. So obviously there's some swelling from the anesthesia, so it's not like the full result there, but he was very happy to see that we had followed the plan, and he could also get an idea of the results. This is a year after, so you can see it's got this hair shorter overall, but the beard here, where it's our interest there, you can see how these areas are totally covered right now. It's not totally solid with hair. There's some gaps, which is natural, but we connected the mustache here as well and kind of curtained over here. We also did a little bit of grafts into the cheeks because he had some thinner spots there, but these are very minimum. The most of the result was right here. So, it looks good, looks natural. He can shave it if he wants to, won't show anything. Here you have a comparison of before and after. These are about a year apart. So again, where it used to be that there was these gaps, now it's all full with hair, and these hairs will grow longer if he wants to. They're permanent, they're never going to go anywhere. Again, a little close-up of the before and after. So beard transplants are really cool to do. I did one for my son Bruno about 8 months ago, I think. He's looking really good too. For him, we did more of the cheeks here because it was thin, also under the lip. And not everybody needs as many transplants or as many grafts. Some people come in and they have just a little gap on either side. Sometimes they have a beard, but they just want to make it a little fuller. And transplants are a great option for that. So if you're interested in something like this, we offer free consultations. We will tell you if you're a good candidate for it. There are some patients that are not good candidates for beard transplants because of scarring, potential scarring on the face. So also works well, before I forget to mention, if you have scars on your face. So I've had plenty of patients who had cleft lip surgery and they had that little linear scar here on the lip. The grafts can cover very well. I've had patients that had dog bites or reconstructive surgery for skin cancer and they have scars where the beard is, and so we can fill those with hair and help them disguise it or conceal them. So beard transplants are great. It's a technique that we've been using for many years. Keeps getting better and better. Recovery is about a week, very quickly, and you can enjoy, for the rest of your life, you can enjoy better facial hair if that's what you want. So call us up, go to the website, subscribe to the channel here, like the video if you do, and we'll see you for the free consultation and give you some advice. I'll talk to you next time. Take care.